This is LiveWell Talk on Pulse Field Ablation. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. One of the most treated heart rhythm disorders in the United States is an irregular heart activity known as atrial fibrillation. Return to the podcast today to discuss a new treatment option is Dr. Weiwei Li, electrophysiologist at St. Luke's Heart Care Clinic. Welcome back, Dr. Li.
Thank you for the invitation. We did this a little while ago.
Yes, we did.
Yeah, for general electrophysiology. And today we're mainly focusing on the atrial fibrillation and what's the treatment options and what's the new options. Yeah.
Yeah, I think, I think without going into the Google machine and looking up pulse field ablation, I think people are excited about all the new toys that you have in electrophysiology and the ability to treat these conditions. And as we were talking before we started the podcast, getting patients off anticoagulation is such a momentous occasion for most patients, and also improving their quality of life.
Yes.
Now, start with, what is atrial fibrillation? We've talked about that before. People see the cardiac commercials and et cetera. But tell us what is atrial fibrillation, and what are the symptoms that a patient might have?
So atrial fibrillation is the most common sustained arrhythmia in cardiology practice. It's actually affect about 2.2 million people in the United States, and projected by the year 2050, there will be 16 million United States people have atrial fibrillation.
So about 1 out of 10 people actually have atrial fibrillation.
And then this thing increasing with age, like when people age about 60, 6% of them are going to have atrial fibrillation. Age about 80, about 10% of them are going to have atrial fibrillation. It actually increase the mortality and mobility in industry, like the society. It's basically the upper chamber of the heart become chaotic and irregular beat, and it's not synchronized with the bottom chamber of the heart. And so what people feel, some people, they don't feel any symptom, and some will feel palpitations. Some feel short-winded, decreased access tolerance, fatigue, some feeling lightheaded, dizzy. So they're very broad symptom that they can present with atrial fibrillation.
So that dysynchronization, or that getting out of rhythm, it's kind of like the old carburetor, the timing in your carburetor. And in your car, if your timing was off, the pistons didn't fire at the right times, and then so you had less performance. So that kind of happens to people too, doesn't it?
Yes, yep. And this is all because there is anatomic or structure or electrical system of the heart was damaged or diseased, and that's make the heart out of sync. Yeah.
So this bad wiring, if that's what we want to call it, but what is pulse field ablation? I think we all know what a pulse is, and we know what fields are, and we know what ablation is. But when you put the three of them together, what is that?
Yeah. So this pulse field ablation is a new technology in the cardiology field. And it's basically non-thermal ablation source. The conventional, what people already heard, is radiofrequency ablation or cryoablation. And those are thermal-related ablation, either heat or freezing the part of the heart which carry all the triggers for atrial fibrillation. And this new technology is largely non-thermal energy source. Basically, it's involved applying high voltage electrical field, electrical impulse in really short duration. We're talking about milliseconds duration to the heart tissue. What it does, it will cause little holes or pores in the cell membrane. And then this irreversible electroporation will kill the cell. And this does not involve excessive heat or cold involved. And the principle of this idea is when each type of different tissue, their cell membrane has different makeup. So when we apply all this high voltage power to the tissue, some tissue will be damaged, but some tissue will not. This is not a new concept. Actually, the electroporation is used in biology. Scientists using those to introduce drugs or DNAs or into genetic material into the cells. And then this has been started at least 2007 when people use irreversible electrophyllation to treat cancers in animal models. And then 2011, scientists began to use this irreversible electrophyllation to do pulmonary vein isolation in animal models. Yeah.
So if I have atrial fibrillation, which I don't, but if I did, would I have to could this replace medications for me? Could I possibly get off my medications for atrial fibrillation if rate control or anticoagulation if this works?
Yes. So this is proven to be more effective compared with any medications available we're using to prevent atrial fibrillation. Because we know there's no cure for atrial fibrillation. All the things we're doing, medications, cardioversions, procedures, is to decrease how often people in atrial fibrillation. And the ablation is much more effective compared with medications.
Yeah. I do think, though, just over reflecting on my career, and it'd be interested to see what you think. I think the primary care clinicians, I don't see patients like I used to that show up with a new stroke and they're in AFib and they had no clue. I don't know if we just do a better job of picking up on it, or I don't know. It seems like you would see quite a few of those patients in the hospital at any given time, and it just doesn't seem like you see that like you used to. But you still see a patient pre-op, maybe 50 years old, 55 years old, they need a knee replaced, have no problems, and they're in AFib. Don't know when it started, don't know how it started.
Yeah.
And they feel fine, but they're at high risk of complications. What are some of those complications of atrial fibrillation?
So one of the fiercest concern is a stroke, because when the upper chamber, lower chamber out of sync, the blood flow become really slow, so clot can form. And then the risk factor for clotting forming, including hypertension, diabetes, heart attack, or history of a stroke or heart failure. So the more point you have, the more risk to have a clot. So that's I think the fiercest concern. People do not know they're in atrial fibrillation, and then they have a clot in the heart, and then they present it to the hospital with a stroke. And other things, the upper chamber, lower chamber, they don't talk to each other, and people doesn't feel symptom until it's too late when the bottom chamber become really weak, and then they have heart failure.
Or they don't feel symptoms unless it's really fast.
Yes. Yeah.
I think it was a German study, and they put internal monitors in them, and they said you have, I want to say it was 24 to 48 hours to come to the ER if you go in atrial fibrillation, right?
Yeah.
And like the average amount of time that someone had been in AFib prior to presentation was a week. Because they didn't feel it when it was slow.
Yeah.
They felt it when it was fast, right?
Yeah.
And so it can really silently sneak up on people, lack of a better term.
Yeah.
What now everyone's just pulling their cars over the side of the road, getting on Google, looking up pulse field ablation. But how does someone get to you to evaluate whether or not they need this?
I think some patients, they have symptoms, so they go to the primary doctor or cardiologist, and then we evaluate the symptoms. How bad you're in atrial fibrillation? Is it paroxysmal, what's so-called? That means comes and goes. The heart can reset, or patient in longer atrial fibrillation, more persistent, depending on their symptoms. And then how slow, how fast the heart rate, we try medications. Or people cannot tolerate medication, or medication doesn't really do a good job. Or sometimes we offer even ablations for the first-line treatment. Yeah.
So a younger patient it might be ablation may be the first-line treatment rather than loading up on amiodarone and all those toxic medications.
And also patients, they have AFib, they have bad heart failure. So then we will treat it really aggressively. And all this was reflected in the most recent guideline published last year. Yeah.
So the Heart Center going to be expanding in 2025, huge expansion. What are you most excited about in that?
So actually, we have 2 electrophysiology lab now. The second lab is going to open in September. We have new electrophysiologist physician join us next week. So we'll have 2 lab functional at the same time. So we'll be able to do more procedures for patient and then get them into the procedure sooner than current schedule. And then, of course, there will be more expansion of the cardiac holding area, recover area. So I think we can provide even more service to our community.
Yeah, Dr. Rasmussen joined you guys.
Yes, yeah, exactly.
You both were hospitalists, weren't you?
At one point, yes.
Yeah.
Yeah.
When I ran the program.
Yes,
Yeah.
yeah.
Well, we refer to that as the golden age of hospital medicine when I ran the program. Dr. Li, thank you again for joining me today and educating our listeners about atrial fibrillation and pulse field ablation, and as well as just electrophysiology. To learn more about heart care services at St. Luke's, visit unitypoint.org/cr-heart. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.